And one way to make the consultation better is to talk about options. Now there's various stages that you could talk about options in the consultation, but there are two main ones, and this is at the options for diagnosis and the options for management. And when it comes to the options for diagnosis, what you're aiming to do is to put in the range of things that you're thinking about or are possible, but weight them to indicate which one is more likely and which one is less likely. And by covering all the options, you are showing the patient you've thought about that, and you are also covering yourself if one of the other possible causes comes out as the answer. So that helps to build confidence in that. And when it comes to the options for management, it helps to include the whole range of options. So again, the individuals are aware that you've discussed them and thought about them. And that goes right from no action at all or no change through to a referral or possibly even admission to hospital. And at each stage you're talking about the pros and cons very briefly to indicate what you've thought about. So it might be, we don't have to do anything in this situation. With time it'll probably settle down. We could do some simple things that might help a little bit for this pain, for example, by doing some local treatments, heat or cold or massage of the area. Or we could use some painkillers, and there is a range of painkillers that we can talk about to help in this situation. Or we could possibly involve the physiotherapist. I'll consider X-ray for this. X-rays are unlikely to make a difference. The physiotherapist, there's a bit of a wait, but we could do that. And of course there's private or NHS options to refer to a physiotherapist. And finally, we could refer you up to the hospital. I'm not sure it's going to make any difference at this stage, but we could certainly hold it in reserve as one of the options. How would you feel about those options? Could you let me know what you're thinking as I was discussing that? Now that may be a way of handling the options for management, and it's fairly generic, the approach there, but you could tailor it to the individual condition. But you're aiming to pick up on some key points there, doing nothing, local treatments, painkillers, physiotherapy, x-rays, through to referral, and those sort of tend to be the main principles on the way.